Contact lenses, understanding risks and maintaining eye health. For millions, contact lenses offer unparalleled freedom, convenience, and a clear view of the world without glasses. They've become an integral part of daily life for vision correction, empowering active lifestyles and enhancing appearance. However, beneath this veneer of convenience lies a critical truth. Contact lenses are medical devices that, if not properly managed, can pose significant risks to eye health. This comprehensive article is designed for contact lens wearers to understand the full spectrum of potential eye diseases and complications, from common irritations to devastating infections that can lead to permanent vision loss. We'll delve into how improper use can gradually affect your vision, clarify the relationship between contacts and other serious eye conditions like glaucoma or cataracts, and crucially, outline the golden rules of care, including specific warnings about water exposure. Our aim is to provide you with essential information on selecting the right lenses, maintaining meticulous hygiene, and adhering to recommended eye exam frequencies. By understanding these vital aspects, you can significantly mitigate risks and help ensure you continue to enjoy the benefits of clear, healthy vision for years to come. The spectrum of contact lens complications. Contact lens-related eye conditions can broadly be categorized into infectious and non-infectious issues. Infectious keratitis, the most serious threat. Infections of the cornea, the transparent, dome-shaped front surface of the eye that covers the iris and pupil, represent the most severe complication. If left untreated, these infections, collectively known as keratitis, can lead to painful corneal ulcers, permanent scarring, significant vision loss, or even necessitate a corneal transplant. Symptoms: intense eye pain, significant eye redness, blurred or hazy vision, eye discharge, watery, mucus, or pus. Extreme light sensitivity, photophobia. Feeling like something is in the eye, foreign body sensation. In severe cases, a visible white spot or ulcer on the cornea. Leading causes include bacterial keratitis, the most common type, often involving bacteria like Pseudomonas aeruginosa or Staphylococcus aureus. These bacteria, commonly found on skin or in water, can rapidly multiply on improperly cleaned lenses or cases, or when lenses are overworn, especially overnight. Fungal keratitis, less common but often more challenging to treat. These infections can occur from exposure to fungi, particularly if lenses come into contact with contaminated water or plant material. Acanthamoeba keratitis, a rare but devastating infection caused by an amoeba found in tap water, lakes, and hot tubs. It's strongly linked to rinsing lenses with tap water, using homemade saline solutions, or swimming with contact lenses. The contact lens can act as a vehicle, trapping the amoeba against the eye. This infection can be notoriously difficult to eradicate and often leads to severe vision impairment. Viral keratitis. While not directly caused by contact lenses, wearing lenses can exacerbate existing viral infections, e.g., herpes simplex virus, by compromising the corneal surface. Corneal ulcers. A corneal ulcer is an open sore on the cornea, typically a direct consequence of untreated infectious keratitis or severe irritation. Symptoms: intense pain, redness, blurred vision, discharge, light sensitivity, a feeling like something is in the eye. Often, a visible white or gray spot on the cornea. Corneal ulcers are medical emergencies requiring immediate attention to prevent irreversible damage. Healing of deep or extensive ulcers often results in permanent corneal scarring, which, particularly if central, can lead to significant and irreversible vision loss by blocking or scattering light. Corneal hypoxia and associated issues. The cornea is unique in that it receives most of its oxygen directly from the air. Contact lenses, even modern highly breathable ones, act as a barrier, reducing oxygen flow. Chronic oxygen deprivation, hypoxia, due to overwear or older lens materials can lead to corneal edema, swelling of the cornea. O symptoms, blurry or hazy vision and discomfort. Persistent edema can contribute to ongoing subtle blurry vision. Corneal neovascularization, the growth of new, abnormal blood vessels into the clear cornea. This is problematic because these vessels aren't supposed to be there and can obstruct or scatter light, impacting vision if they grow into the central visual area. This is a progressive condition if chronic oxygen deprivation continues. Corneal microcysts and vacuoles, microscopic fluid-filled pockets or debris within the corneal layers, indicating metabolic strain. O symptoms, usually asymptomatic to the wearer, detected during an eye exam. Long-term hypoxia can also contribute to a gradual increase in nearsightedness, myopic creep. Allergic and inflammatory conditions. Your eye can react to contact lens materials, deposits on the lens surface, or lens care solutions. Giant papillary conjunctivitis, GPC, an allergic inflammatory reaction of the inner lining of the eyelids. O symptoms, formation of large, cobblestone-like bumps, papillae, on the underside of the upper eyelid, leading to itching, redness, mucus discharge, and contact lens intolerance. Contact lens-induced acute red eye, CLAR, a sudden, painful inflammatory reaction. O symptoms, marked by redness and light sensitivity, often linked to bacterial toxins accumulating on lenses, particularly with extended or overnight wear. Allergic conjunctivitis, a general allergic reaction to specific lens solutions or materials. O symptoms, resulting in widespread eye redness, itching, and watering. Dry eye disease. Contact lenses can significantly contribute to or worsen dry eye symptoms. Lenses can interfere with the natural tear film either by acting as a physical barrier, absorbing moisture, or altering tear stability. Symptoms: dryness, irritation, a gritty or sandy sensation, excessive tearing, a reflex to severe dryness, fluctuating vision, blurry vision that clears with blinking, burning or stinging sensation. If dry eye is chronic and severe, it can lead to surface damage on the cornea, punctate keratitis, which can impact vision quality and clarity over time. Corneal abrasions. A scratch on the corneal surface. Symptoms: sudden pain, redness, tearing, light sensitivity, feeling like something is in the eye. Corneal abrasions can occur due to improper insertion or removal techniques. A foreign body, like a speck of dust or an eyelash, getting trapped underneath the lens. A torn or damaged contact lens. Even minor abrasions compromise the eye's protective barrier, making it more susceptible to infection. Contact lens overwear syndrome, CLAS/intolerance, CLI. This is a broad term describing chronic discomfort and intolerance to contact lens wear, often resulting from habitually exceeding recommended wear schedules or neglecting proper care. It can encompass several of the aforementioned issues. Symptoms: chronic eye discomfort or pain while wearing lenses, redness, dryness, feeling unable to tolerate lenses for extended periods, reduced wearing time, ultimately making it impossible or very uncomfortable to continue wearing lenses. Corneal warpage or distortion. Prolonged wear of ill-fitting or older, less oxygen-permeable contact lenses can, in some cases, cause temporary or even long-term changes to the natural curvature of the cornea. This warping creates an irregular corneal surface. Symptoms: distorted vision even when lenses are removed. Blurred vision, ghosting, or double vision, diplopia. Difficulty achieving clear vision with glasses after removing lenses. An irregularly shaped cornea cannot focus light properly on the retina, leading to impaired vision. This can be a gradual process as the cornea slowly molds to the lens. How contact lenses can gradually worsen vision. As highlighted above, contact lens use, especially improper use or overwear, can subtly and gradually worsen vision over time through several mechanisms. Chronic hypoxia, persistent oxygen deprivation can lead to corneal swelling and the growth of new blood vessels, neovascularization, into the cornea. If these vessels enter the central visual axis, they can directly obstruct or scatter light, leading to a permanent reduction in vision. Corneal warpage, gradual reshaping of the cornea due to ill-fitting or overworn lenses creates an irregular surface. This irregular astigmatism causes distorted, blurred, or ghosted vision that may not fully resolve even after discontinuing lens wear. Corneal scarring from infections. While an infection can cause rapid vision loss, if minor or recurrent infections lead to multiple small scars, or if a severe infection leaves a significant scar, vision can be permanently and severely affected. Chronic dry eye, an unstable or insufficient tear film, exacerbated by contact lenses, can lead to fluctuating vision and, in severe cases, surface damage to the cornea that impacts clarity. Contact lenses and other common eye conditions, cataracts, high eye pressure/glaucoma. It's important to clarify the relationship between routine contact lens wear and other common eye conditions. Contact lenses and glaucoma, an indirect relationship. Routine contact lens wear does not directly cause glaucoma. Glaucoma is a condition typically linked to high intraocular pressure damaging the optic nerve. However, there are indirect ways contact lens use can intersect with glaucoma. Complications leading to secondary glaucoma. If an infection, like bacterial or fungal keratitis, leads to severe inflammation inside the eye, uveitis, this inflammation can cause a secondary form of glaucoma by clogging the eye's drainage system, the natural pathways that allow fluid to leave the eye, leading to elevated intraocular pressure. This is a consequence of the infection, not the lens itself. Managing glaucoma with lenses. For individuals already diagnosed with glaucoma, wearing contact lenses requires careful consideration. Many glaucoma patients use daily eye drops, and most soft contact lenses need to be removed before applying drops and reinserted after a short wait, typically 15 minutes, to avoid staining the lens or interfering with medication absorption. This can impact medication adherence. Some glaucoma medications also exacerbate dry eye, making contact lens wear less comfortable. Impact on IOP measurement. Contact lenses can temporarily alter corneal shape or thickness, potentially affecting the accuracy of intraocular pressure measurements. Scleral lenses. Some specialized contact lenses, like scleral lenses, have been shown in some studies to temporarily increase intraocular pressure in some individuals during wear. Future technologies. Interestingly, research is active in developing smart contact lenses designed to monitor intraocular pressure continuously throughout the day for glaucoma patients, and even drug-delivering contact lenses that can release glaucoma medication slowly and consistently. These advanced lenses are specifically engineered not to increase eye pressure, but rather to aid in its management or monitoring. Contact lenses and cataracts. Contact lenses do not directly cause cataracts. Cataracts are a clouding of the eye's natural lens, primarily due to aging, but also from injury, certain medications, like corticosteroids, excessive UV exposure, or other medical conditions. However, indirect links exist. Severe eye infections/inflammation. Poor contact lens hygiene leading to severe infections can cause significant internal eye inflammation. Prolonged or severe inflammation, uveitis, has been linked to accelerating cataract formation in some cases. Steroid use. If steroid eye drops, known to cause cataracts with prolonged use, are prescribed for contact lens-related inflammation. The lenses can absorb the steroids and prolong their contact with the eye, potentially exacerbating this side effect. Minimizing risks, the golden rules of contact lens care. To help ensure the safe enjoyment of contact lenses, strict adherence to proper hygiene and wear schedules is paramount. Wash and dry hands. Always thoroughly wash and dry your hands before touching your contact lenses or eyes. Proper cleaning and disinfection. Use only fresh, commercially prepared contact lens solution recommended by your eye care professional. Never use tap water, saliva, or homemade saline solutions. Adhere to wear schedules. Never wear lenses longer than recommended, daily, bi-weekly, monthly. Never sleep in lenses. Unless explicitly prescribed for extended wear and regularly monitored by your eye doctor, do not sleep in contact lenses. This dramatically increases the risk of serious infections. Replace lenses and cases regularly. Replace your lenses as prescribed, and your lens case at least every 3 months. Clean the case after each use and allow it to air dry. Avoid water exposure. Do not swim, shower, or use hot tubs while wearing contact lenses. Further detail on this crucial rule is provided below. Contact lenses and water exposure, a critical warning for swimmers. It's strongly advised by eye care professionals, the FDA, and the CDC to avoid exposing contact lenses to any type of water. This includes swimming pools, oceans, lakes, rivers, hot tubs, showers, baths, and even tap water for rinsing or storing lenses. The consequences of ignoring this rule can be severe and vision-threatening. Why water exposure is so risky. 1. Waterborne microorganisms. The threat of acanthamoeba, water, especially natural bodies of water and even treated tap water or chlorinated pools, can harbor countless dangerous microorganisms, including bacteria, viruses, fungi, and parasites. The most notorious is acanthamoeba, a microscopic amoeba that can cause acanthamoeba keratitis. This is a rare but devastating eye infection that is notoriously difficult to treat, often leading to severe pain, permanent vision loss, or even necessitating a corneal transplant. Contact lenses can act as a trap, allowing these microbes to adhere to the lens surface and then transfer to the cornea, where they can cause infection. 2. Chemical irritation. Chlorine and other chemicals in pool water can bind to soft contact lenses, causing significant irritation, redness, dryness, and discomfort. These chemicals can also alter the lens shape or cause them to stick tightly to the eye, making removal difficult and potentially leading to corneal abrasions. 3. Lens swelling and discomfort. Soft contact lenses are designed to absorb water. When exposed to pool or natural water, they can absorb additional water, causing them to swell, change shape, and become ill-fitting and uncomfortable. This can also lead to blurred vision. 4. Lens displacement or loss. Water pressure and movement, especially during diving or vigorous swimming, can easily dislodge or even wash out contact lenses, leading to immediate blurry vision or lost lenses. This is particularly true for rigid gas permeable (RGP) lenses, which are smaller, harder lenses compared to soft contacts. 5. Compromised tear film. Swimming can wash away the natural tear film that lubricates and protects the eyes, exacerbating dry eye symptoms and making the eyes more vulnerable to irritation and infection. Recommendations for swimmers, and impact on lens replacement. Given these severe risks, the safest recommendation is to completely avoid wearing contact lenses while swimming. However, if clear vision is absolutely essential for swimming, e.g., for competitive swimmers, water sports, or safety reasons, strict precautions are paramount. 1. Prescription swim goggles, the safest alternative. This is the most highly recommended and safest option. Prescription swim goggles provide clear vision underwater and create a sealed barrier that effectively keeps water and contaminants away from your eyes and contact lenses. This completely eliminates the need to expose your contacts to water. 2. Daily disposable contact lenses, the preferred last resort. If wearing contact lenses for swimming is unavoidable, daily disposable lenses are the safest contact lens option. Crucial replacement frequency. For swimmers using daily disposables, the recommendation is to discard them immediately after swimming. Don't try to clean or reuse them, even for a short period. This eliminates the need for cleaning and disinfection after potential contamination and helps ensure you start with a fresh, sterile pair for the rest of your day. This means that for someone who swims frequently, e.g., daily, they would effectively be using a new pair of daily disposables specifically for swimming, and then another fresh pair, or switching to glasses, for the rest of their day. 3. Strict post-swim hygiene. For reusable lenses, generally discouraged using reusable lenses, like 2-week or monthly lenses, for swimming is generally discouraged even with goggles due to the risk of microleakage and water absorption. If this can't be avoided, impact on replacement frequency, you should remove them immediately after swimming and perform a thorough rub and rinse disinfection process with fresh, sterile solution, followed by the full recommended soaking time, usually at least 4 to 6 hours, or overnight. Some eye care professionals might even recommend discarding reusable lenses after a single swimming session if they were exposed to water, regardless of their scheduled replacement, effectively increasing their replacement frequency for swimming days. Never top off. Always use fresh contact lens solution. Never top off old solution in your lens case. Give eyes a break. Consider giving your eyes a break by wearing glasses for a few hours or the rest of the day after swimming, especially if you've worn reusable lenses. 4. Always wear tight-fitting goggles. If you choose to wear contact lenses while swimming, always wear high-quality, tight-fitting swim goggles to provide a physical barrier. Remember, however, that goggles aren't foolproof. Leaks can still occur. 5. Don't open eyes underwater. Even with goggles, avoid opening your eyes underwater if you're wearing contacts. 6. Seek professional advice. Discuss your swimming habits and needs with your eye care professional. They can provide information on the safest options for you, which may include prescription swim goggles, daily disposable contact lenses, with immediate discard post-swim, alternatives like orthokeratology, Ortho-K, which involves wearing special RGP lenses overnight to temporarily reshape the cornea, allowing for clear vision during the day without any contacts. Discussing refractive surgery options like LASIK for a permanent solution if you're a very frequent swimmer. How to select proper contact lenses. Selecting the proper contact lenses is a crucial decision that goes far beyond simply knowing your eyeglasses prescription. Contact lenses are medical devices that interact directly with the delicate surface of your eye, and an improper fit or material can lead to discomfort, poor vision, or serious eye health complications. Therefore, the selection process should always involve a qualified eye care professional, optometrist or ophthalmologist. Start with a comprehensive eye exam and contact lens fitting. This is the most critical first step. You can't, and shouldn't, buy contact lenses without a valid prescription from an eye care professional. A contact lens prescription is different from a glasses prescription because it includes specific measurements and parameters related to the contact lens itself, not just your refractive error. During a contact lens exam and fitting, your eye doctor will assess overall eye health. They'll check for any underlying eye conditions, like dry eye, allergies, infections, or corneal irregularities, that might affect your ability to wear contacts comfortably or safely. Measure your eyes. Corneal curvature, keratometry/topography. They'll measure the curvature of your cornea. This is crucial for determining the correct base curve of the contact lens, which refers to the curvature on the back surface of the lens that rests on your eye. A precise fit, not too tight or too loose, is essential for comfort, clear vision, and healthy oxygen flow. Advanced tools like corneal topographers can create a 3D map of your corneal surface. Iris and pupil diameter, measurements of your iris, colored part of the eye, and pupil, black center, help determine the overall diameter of the contact lens for proper coverage and optics. Tear film evaluation, the quantity and quality of your tears are assessed, e.g., using a tear film breakup time test or Schirmer's test. A healthy tear film is vital for contact lens comfort and to help prevent dryness. If you have dry eyes, specific lens materials or treatments may be considered. Discuss your lifestyle and needs. This is where your personal input is vital. Your eye doctor will ask about your daily activities, work, hobbies, sports, screen time. How often you plan to wear contacts, daily, occasionally, extended hours. Your tolerance for cleaning and maintenance. Any specific visual demands, e.g., driving at night, reading small print. Trial lenses. Based on all these factors, your doctor will select initial trial lenses. You'll wear these for a period, from minutes in the office to a week at home, to assess comfort, vision, and how the lenses interact with your eyes. They'll observe the lens movement on your eye. Follow-up appointments. One or more follow-up visits are typically required to help ensure the lenses are performing well, your eyes are healthy, and you're comfortable before a final prescription is issued. This is especially true for new wearers. Instruction on handling and care. For first-time wearers, the doctor or their staff will provide detailed instructions on how to safely insert, remove, and care for your contact lenses. Key factors to consider, in consultation with your eye doctor. Once you're cleared for contact lens wear, your eye doctor can help you choose the best type based on several factors. Lens material. Soft contact lenses, hydrogel and silicone hydrogel. Pros, most popular type, very comfortable, easy to adapt to, available in various modalities. Silicone hydrogel lenses offer significantly higher oxygen permeability, meaning how well oxygen can pass through the lens to your eye, which is crucial for corneal health. Cones, can absorb pollutants easily, require specific cleaning, unless daily disposable, and may be more fragile than RGPs. Suitability, ideal for most people seeking comfort and convenience for daily wear. Good for active lifestyles. Rigid gas permeable, RGP, lenses. Pros, these are hard, contact lenses that provide sharper vision, especially for higher astigmatism or irregular corneas like keratoconus, allow more oxygen than older soft lenses, are durable, and resistant to deposits. Can last longer and be more cost-effective over time. Some can be used for orthokeratology, ortho-K, to reshape the cornea overnight. Cones, less comfortable initially, requires an adaptation period, smaller in size, and can dislodge more easily. Suitability, excellent for those needing very crisp vision, high astigmatism, keratoconus, or individuals seeking a more durable lens. Hybrid contact lenses. Pros, combine the crisp vision of an RGP center with the comfort of a soft lens skirt. Cones, more complex fitting process, can be more expensive. Suitability, a good option for people with astigmatism or mild corneal irregularities who find RGPs uncomfortable but need better vision than soft lenses provide. Scleral lenses. Pros, large diameter RGPs that vault over the entire cornea, resting on the sclera, white part of the eye. They create a fluid-filled reservoir over the cornea, offering exceptional comfort and vision correction for complex conditions. Cones, complex fitting, higher cost, requires specific handling. Suitability, primarily used for severe dry eye, advanced keratoconus, post-surgical corneal irregularities, or very high prescriptions where other lenses fail. Wear schedule, modality. Daily disposable lenses. Pros, most hygienic option, fresh pair every day, no cleaning solutions needed, lowest risk of infection, excellent for allergies or busy lifestyle/travel. Cones can be more expensive in the long run. Suitability, often recommended for most people, especially those with allergies, dry eyes, or a history of infections. Frequent/planned replacement lenses, 2-week, monthly. Pros, more cost-effective than dailies, good balance of hygiene and value. Cones, requires daily cleaning and disinfection with solution, requires a lens case. Higher risk of deposit buildup and infection compared to dailies if not cared for properly. Suitability, common choice for those who want to balance cost and convenience. Extended wear lenses. Pros, can be worn continuously for several days or up to 30 nights, depending on the lens type and individual eye tolerance. Offers maximum convenience. Cones, significantly higher risk of serious eye infections, e.g., microbial keratitis, due to reduced oxygen and increased exposure to microbes. Requires strict adherence to recommended wearing schedules and follow-up care. Suitability, only for select individuals whose eyes can tolerate them, after thorough discussion and close monitoring by an eye care professional. Many eye doctors advise against sleeping in any contact lenses due to the increased risk. Vision correction needs. Spherical lenses, correct nearsightedness, myopia, or farsightedness, hyperopia. Toric lenses, designed for astigmatism, an irregularly shaped cornea, and have different powers in different meridians to correct the uneven focus. Multifocal/bifocal lenses, correct presbyopia, age-related farsightedness, which makes it hard to focus on near objects, allowing clear vision at multiple distances, near, intermediate, and far, in the same lens. These may take some adaptation. Special features/other considerations. UV protection. Some contact lenses offer UV blocking, which is a good supplementary protection but not a substitute for sunglasses that cover the entire eye and surrounding skin. Handling tints. A light tint in the lens makes them easier to see in the case or on your finger, but doesn't change your eye color. Cosmetic, color, lenses, designed to enhance or change eye color. Crucial note, cosmetic contact lenses, even plano, non-corrective, ones, are still medical devices and require a prescription and professional fitting to help ensure safety and proper fit. Never buy them from unverified sources, e.g., online, beauty supply stores, gas stations. Budget. While cost is a factor, it should never be the primary driver. The healthiest and safest option for your eyes should always take precedence. The professional difference. Why you need an eye doctor. Attempting to select contact lenses on your own, e.g., buying online without a current prescription and fitting, is dangerous. Your eye care professional performs critical steps that online vendors or over-the-counter sales can't. Accurate measurements. Only an eye doctor can take precise measurements of your corneal curvature and other eye parameters. Eye health assessment. They can identify conditions that make you unsuitable for contact lens wear or require special lens types. Fit evaluation. They verify that the lens moves correctly on your eye, allowing for proper tear exchange and oxygen flow. Follow-up care, essential for helping ensure long-term comfort and health. Troubleshooting. If you experience issues, they can diagnose the problem and offer solutions. Eye exam frequencies for contact lens wearers. Wearing contact lenses necessitates significantly more frequent and specialized eye exams compared to not wearing them, due to the inherent risks and ongoing monitoring required for ocular health. For people wearing contact lenses, annual exams and beyond. For most contact lens wearers, a comprehensive eye exam is essential at least once a year, every 12 months. This annual visit typically includes a specific contact lens exam component in addition to the general eye health check. Why the annual requirement? Contact lenses are medical devices that sit directly on the delicate surface of the eye, the cornea. This intimate contact necessitates continuous monitoring for several reasons. Risk of infection. Even with meticulous hygiene, contact lens wear increases the risk of serious eye infections, bacterial, fungal, acanthamoeba keratitis. Early detection is crucial to help prevent severe, irreversible vision loss. Corneal health. Lenses act as a barrier to oxygen. While modern lenses are highly breathable, chronic oxygen deprivation, hypoxia, can lead to corneal edema, or even the growth of new blood vessels, neovascularization, into the clear cornea. These changes often develop silently but can progressively impact vision if left unaddressed. Fit and comfort. The fit of a contact lens is critical for both comfort and eye health. An ill-fitting lens can cause irritation, abrasions, or restrict tear flow and oxygen. As the eye's shape can subtly change over time, annual evaluations help ensure the lens continues to fit properly and comfortably. Prescription accuracy. Vision can fluctuate. An annual exam confirms your contact lens prescription is current, providing optimal visual acuity and helping prevent eye strain. Material and solution compatibility. New lens materials and care solutions are constantly evolving. Annual visits allow your eye care professional to recommend the best options for your eyes and address any sensitivities or incompatibilities. Compliance review. Eye doctors can reinforce proper lens care habits and discuss any issues or shortcuts patients might be taking, which significantly increase risk. Significant frequency changes for contact lens wearers, when annual isn't enough. While annual exams are the standard, several situations warrant more frequent visits for contact lens wearers. 1. New contact lens wearers or new lens types. Initial fitting and follow-ups. When someone starts wearing contacts for the first time, or switches to a significantly different type of lens, e.g., from daily disposables to monthly, or from soft lenses to rigid gas permeable, multiple follow-up appointments are often required within the first few weeks or months. These visits help ensure proper fit, comfort, vision, and that the eye is adapting well. 2. Specific lens types and wearing schedules. Extended wear, overnight, lenses. These lenses carry a significantly higher risk of complications, especially serious infections due to prolonged oxygen deprivation and microbial exposure. Wearers of extended wear lenses often require more frequent checkups, e.g., every 6 months, to closely monitor for signs of hypoxia, inflammation, or infection. Specialty lenses, toric lenses, for astigmatism, multifocal/bifocal lenses, or therapeutic/scleral lenses, for severe dry eye, keratoconus, etc., require more precise fitting and monitoring. These patients may need more frequent visits initially or on an ongoing basis to help ensure optimal performance and eye health. 3. Presence of underlying eye conditions. Chronic dry eye. Contact lenses can exacerbate dry eye. Patients with moderate to severe dry eye may need more frequent exams to help manage symptoms, adjust lens types or solutions, or consider prescribed medications to improve tear film stability. Allergies. Individuals prone to ocular allergies, e.g., giant papillary conjunctivitis, may need more frequent visits to help manage inflammatory reactions, adjust lens replacement schedules, or switch to different lens materials/solutions. Recurrent infections or inflammation. A history of previous contact lens-related infections, keratitis, or corneal ulcers necessitates closer monitoring to help prevent recurrence and ensure the eye is healthy enough for continued lens wear. Corneal irregularities. Conditions like keratoconus, a thinning of the cornea, require very specific contact lenses and frequent monitoring to track corneal changes and ensure the lens maintains its corrective and therapeutic function. For experiencing symptoms or discomfort. Any concerning symptoms. As the article states, if a contact lens wearer experiences any unusual redness, pain, discomfort, discharge, extreme light sensitivity, or sudden vision changes, they should remove their lenses immediately and contact their eye care professional without delay, regardless of their last scheduled exam. This is a crucial, unscheduled visit. Persistent discomfort. If a patient consistently experiences discomfort, dryness, or reduced wearing time with their lenses, even if not an emergency, it warrants a visit to evaluate the cause and find a better solution. 5. Systemic health conditions affecting the eyes. Diabetes. Individuals with diabetes are at higher risk for various eye complications, e.g., diabetic retinopathy, dry eye, that can be exacerbated by contact lens wear. They may require more frequent, often annual, exams to monitor overall eye health. Autoimmune diseases. Conditions that affect the immune system can impact eye health and potentially increase susceptibility to contact lens-related issues. Conclusion. In conclusion, contact lenses offer unparalleled freedom and convenience for vision correction, revolutionizing the lives of millions. However, the profound benefits come with an equally profound responsibility. This article has detailed the extensive spectrum of potential complications, from common irritations like dry eye to devastating, vision-threatening infections and permanent vision loss. The overarching message is clear: diligent adherence to proper hygiene, recommended wear schedules, and consistent professional oversight are not merely suggestions, but absolute necessities. Neglecting these golden rules, particularly regarding water exposure and overwear, significantly escalates the risk of severe and potentially irreversible damage to your vision. Regular, comprehensive eye exams, often annually or more frequently based on individual circumstances and lens type, are your frontline defense. These professional assessments can detect subtle changes before they become critical problems. Ultimately, contact lenses are a privilege that demands respect for your ocular health. Should you ever experience any unusual eye redness, pain, discomfort, discharge, extreme light sensitivity, or a sudden change in vision while wearing contact lenses, remove them immediately and contact your eye care professional without delay. Prompt action can make all the difference in helping prevent severe and permanent vision loss and ensuring you can continue to enjoy the benefits of clear, healthy vision for years to come.